Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning, everybody. Good morning, Anita.
Yeah, well, this is wonderful to talk coming from the Regents Park Rehabilitation Center.
Right. How's Bill doing?
Bill is making improvements. He's
Good.
moving slowly, but I'm so excited about I know you want to do something first, but I can't wait for people to hear about Dr. Luke Maj.
He's my secret weapon. But we want to put our condolences out there for the shooting that took place in Florida Airport, and a speedy recovery for the victims that are still hospitalized in the different area, and for the community to continue to hang together like we always do, and pull together like American, like we always do. And we'll get over this, and we'll become better person.
But doctor, just working with that a minute, because they now see that the man has very serious mental health problems. That's something that you've talked about before. If you as a physician have to recognize if someone is in need of mental health work, that they need to go and people need to support that.
Well, you're going to hear from Dr. Luke Mike today, and mental health and the condition that he treats are two conditions that are under research, under recognized. And with the mental health side, of course, the consequences are that we get family that get or killed by people with mental health, and sometimes it pull out into the community and kill hundreds of people in the community. And you get people like people that get high up in power and kill all these Jewish people in Germany. And all of those people can have different form of mental disease, and they don't go recognized. They keep climbing up in society, and it's horrible. It's a horrible situation. But let's switch gear and talk with Dr. Mai. So that the same thing that happened to one of our listeners doesn't happen at this time. Dr. Mai, you spell his name M-A-J, no M-A-I. Because one of the listeners, Dr. Mai, that listened to the program. Mm-hmm. She misspelled my name. She just wrote it down the way it sounds, Mencia. And she I think she skipped the N or something, and Googled the name that she wrote down and found this doctor in West Palm Beach, and went to see the doctor. Went into the office, and when she's talking to the doctor, let's talk about holistic approach. Oh, no, I don't do that stuff. And she go like, oh, my God, you're not Dr. Mencia. You're not the doctor I'm looking for.
That's pretty funny.
And she did make it to us. She came to the Boynton office, and she did make it to us. And we laughed like crazy when she was saying, Anita told me the story. So...
Well, that's perfect. I mean, I really appreciate being here. My name is it's of Polish descent, and a lot of patients look at the name and they look at me and are so confused at how to say it. And I say, look, it's Mai, like Mai Tai. And then they get kind of excited, like, oh yeah, I get it. Okay.
That's funny because I have a friend. His name is Mai, M-Y, and when I first met her, she said, I'm Mai. Mai what? No, Mai.
My what?
So that's very funny. Her name's Mai. I don't know who did that.
And it's
anyway,
all Mai.
Oh my. And she's gorgeous, so oh my is true. But Dr. Mai, you were on my show once before. I was looking at your credentials, and you were terrific. And I'm sorry I'm not there in person with you, but I'm so glad you've affiliated yourself now with Dr. Mencia. That's great.
Yes.
I really appreciate that. I try to, as much as possible, educate people and physicians and practitioners about what we do and what services are available. And it was just, I guess, by random luck that Dr. Mencia and I met, and things have been just working out great. And I really enjoy working with him and being at his location.
Yeah. And he's so busy, Anita, when he comes there. But my reward is when I see those patients coming back at me. And they, I remember I have this lady that will come to me and say, Dr. Mencia, touch my leg. They are swollen. I have swollen leg, and I would press and try to get my thumb to make an indentation on the skin, and nothing is happening. I say, you don't have swollen leg, honey. Oh, no, Dr. Mencia, no, you do. You don't believe me? No, honey. I believe you, but it's not swollen leg. I think what you have is venous problem. Because, she feels her legs are swollen. So I asked her some of the symptoms. Do you feel tired when you're walking, when you're sitting? She goes, yeah, my leg always feel tired. Even when I'm resting, my legs feel tired and heavy. So I said, well, that's not swollen leg. And we went to the procedure. And after Dr. Mike saw her, she did so well. And she's a completely different person. She said, I can do so many things now because my leg was just pulling me back.
How does that happen, though? How does one get that problem, Dr. Mai?
Yeah, so, I think one of the big issues that we should discuss is that the under treatment or under recognition of venous disease. If you look at the history of venous disease and what we do, most physicians, especially older physicians who see patients, will tell the patients that it's just a cosmetic problem. It's not really anything medical or anything can be done about it. And I constantly have patients who present to me and they say, well, my doctor just said this is just part of getting old. And I said, well, if you can't walk, then that's really bad getting old. You got to be able to walk. So you kind of go through the whole process and try to educate the patients. And then what I do is I usually end up finding who their primary care physician is. I'll go back to them, try to talk to them and say, look, this is a patient that really has a problem. This is what we're doing. And then you should talk to your patient afterwards and see if they've done any better. And unanimously, all these patients do great. And they go back to their primary care physicians or whoever, to their practitioners. And then we get, larger amounts of referrals. Let's talk about venous disease. The big, I guess, idea here is venous hypertension. So high blood pressure on the vein end. I think most individuals as well as practitioners don't know that there is, blood pressure on the arterial side and blood pressure on the venous side. Those are completely two different things. When you go to your physician's office, they're going to put a cuff on your arm and measure your blood pressure. That's actually the arterial blood pressure. That's the pressure of blood going to your organs, to your legs. And then we have to look at the venous blood pressure. That's the return of blood. And that's a little bit trickier because the pressures are so low that they're very difficult to measure and we don't have a way of measuring it. But when those pressures are abnormal, we see the symptoms and we see, the appearance of the skin or the varicosities or things like that. So let's talk about how the veins return blood from the leg. So you don't have a heart in your foot to drive that blood up, and so that's a problem. So that means the blood still has to go from your foot all the way up against gravity, which is very difficult to do. So the way that's done is when you take and you walk, your ankle actually moves, and you can see when your ankle moves, your calf
muscle
moves. Exactly.
Mm-hmm.
So there's this thing called the calf muscle pump. And a calf muscle pump basically squeezes the veins, and as the veins empty, they shoot blood only going up because there are little one-way valves in all the veins. So if the valves are functioning, the valve will open, the blood will go up, and the valve will close. And as the calf muscle continues to pump, the blood should empty from your leg. But the problem occurs when those little valves break. Instead of the valve opening and blood going up, the valve might be destroyed for some reason or another, or degenerate over time, which happens a lot with older individuals. And instead of blood going up, it ends up going back down in your foot, right?
So when the calf muscle compresses, instead of compressing up, it's compressing on both directions.
Exactly.
Okay.
It's basically like when it compresses, the one of the valves should open and the blood should only go in one direction. So that the valves lower below should hold that pressure. When they don't, basically the blood goes back down into your leg, back down into your foot, which causes the venous hypertension or the abnormality.
Okay. So how does one prevent that?
You know what? We look at risk factors and prevention. A lot of it has to do with genetics. So it's one of the biggest risk factors of venous disease is genetics. If your parents or grandparents had bad veins or some venous ulcers or problems like that, you're more likely to get them. So that's number one, and that's the highest risk factor. Number two is your daily life. What are you doing? Are you standing on your legs all day? Are you sitting all day? So that's another big one. So I always tell patients, if you're standing on your legs all day, you should sit down, give your legs a little bit of rest once an hour. If you're sitting all day at a desk, get up, go to the bathroom, get a drink of water, do something to move around, get something to move that ankle around so they can pump that blood out of your legs. Okay. Besides that, other ones being overweight, lack of exercise, trauma, surgery, infections, a lot of these things will add some minor things to it. And then another big one is being a woman, which doubles your risks. Unfortunately, there's not much you can do about that. And then the second one is you double your risk with every child that you bear. And that's because the gravid uterus puts a lot of pressure on the venous structures in the abdomen and pelvis, and that creates venous hypertension as well.
So are you saying that men don't get this?
Men do get it, and what's surprising is that the men that I treat are usually a worse category than the women. And you can imagine, women wear bikinis, they go to the beach, they have skirts, they want to look good. They come in, tiny little vein, they're super excited, they're coming in, I want to get this taken care of because it doesn't look good. And then men, they let things go. We see men usually with Venous disease. You get skin discolorations, you get ulcerations, and that's because they put pants on, they put socks on, like, don't worry about it, and it's not a big deal.
Nobody's going to see it.
No one's going to see it. Yeah, till it's really, really bad at that point.
So you're talking about spider veins. I have spider veins in some areas on my legs. Is that the beginning, or are they just...
And we don't wear support stacking.
Correct.
It doesn't hurt.
I'm wearing mine. Look at this. Every day.
There you go.
Yeah, every day. So let's talk about, let me start with prevention first. So things that you can do, keep a normal weight, exercise. If you're sitting around, especially like on a plane for long distances, take that ankle and move it around. Move your foot and ankle as much as you can, get that blood pumping, get up once in a while. Sitting in an office, do the same thing. Compression socks are actually incredible, and the way they work is they actually give more compression to the outside of the leg. So even if you twitch your toe a little bit, you're moving that muscle, the pressure's so high that it drives that blood out. So compression is really good.
Excuse me, I think, Dr. Mencia, don't you carry compression stockings?
We do carry it, yeah. And sometimes even before the patient, we see Dr. Mai, I have learned so much from this man. So before we say, well, try the compression stacking until we get the ortho, but I can see clinically that the person has venous insufficiency. So I will say, start with the compression stacking if the foods are okay, because some people think compression stackings are those ugly brown stacking or dark brown stacking that we used to get. That some of them you can put your toes outside, some of them. And Dr. Mai has his on is the sleeves. So it doesn't cover, it doesn't cover your feet. It goes from the ankle up to below your knee, the one you have, below your knee. So we have those sleeves that people can put on to help with the mechanism that Dr. Mai will describe a little while back. We get the patient to get the stacking as soon as possible because they help a lot. My staff always teasing me. They call me the tuxedo socks, Dr. Mencia with his tuxedo socks, because I get my socks to come all the way just below my knee because I'm on my feet all day.
So in terms of the socks, the one thing that I always advocate is get a good pair of compression socks. Come in, get measured, get the right size, because there's different levels of compression. You can pick up something, at the local Walmart or Walgreens. They're not going to give you that compression that you really need. And it's a good test for us. One, the patient's symptoms should be relieved partially, if not entirely, but it's only a temporary solution. So we have other permanent solutions that can fix the problem. But for us, let's put the patient in compression like Dr. Mencia does, and they come to see me. By that time, I can already question the patient, say, hey, are you doing better on the compression? A lot of patients are saying, yeah, I'm doing way better. And the compression socks only help with venous disease. So then we know it's not something else, arthritis or something else the patient might be undergoing.
That's great. Well, one thing that might be good to talk to our listeners is because so many people travel and they go on planes, and sometimes you sit there 2, 3, 4 hours, and people don't get up. Why don't you talk about that? What they should do?
It's a really interesting topic, and I actually have a lot of flight attendants, and now I have a whole following of pilots that come to see me. And it started out with just one pilot coming to see me because she had this large varicosity running down her leg. And she says, I constantly am in this plane in the same position. I'm not getting up, and I have these legs that hurt. And we treated her, and she did actually extremely well. And after that, another pilot came, and another pilot came. And it's just kind of been a cascade. And one of the pilots who came actually had a blood clot. And he said, there's this huge community of us, pilots who are worried about getting blood clots because we're sitting in this plane. So we talk to them about, specific to them about certain things, but walking around, I know that the stewardesses or the flight attendants don't want you guys walking around. So if you can get up once in a while, every couple hours, walk to the bathroom, just walk up, get a glass of water, or even just move your ankle up and down. That's the same thing as walking, maybe not as much pressure. For the individuals, such as flight attendants and pilots, we put them in compression. I put every single one of them in compression. I said, look, I also put them a lot of them I put on aspirin and once they get a certain age, but I said, look, put the compression on, move your ankle up and down. If you're able to get up once in a while, get up once in a while. And they do that. They actually follow the instructions pretty well. What's surprising is the insurances for these companies, large airlines, American Airlines, United Airlines, all cover not only venous treatments for them, but they cover up to 6 compression socks, depending on the plan they have per year.
Wow.
Which is surprising. So the industry knows there's a problem. They know there should be something about it. But a lot of the individuals that come and see me, the pilots and flight attendants, don't know about it. So I say, hey, you should talk to the insurance, see what it is. And they come back and almost all of them say, hey, did you know we get all these compression socks?
And they are colorful.
And they're colorful.
Yeah. You can get pink, you can get blue, you can get different.
Come on, you're kidding.
No, they are.
They are. I have these aqua green ones on, but you know what? My biggest seller out of all of them, and it's kind of crazy. It's hot pink.
Hot pink.
I
Yeah.
sell more hot pink socks than any other color. You know,
Not to men.
not to men. It's mostly to women. Men usually go with
I
black.
will wear my
you know.
pink with my pink tie and my pink my
we're in
pink
trouble
shirt.
here. But Dr. Mencia, when someone comes in and they don't tell you about having any of those problems with with their legs, do you normally, as a person that just it's a new patient and you're doing your examination, do you just go and look at that yourself?
We do because as you well know, and we are sort of a little bit different from the general practitioner. When we specialize in geriatrics, part of our training, besides hospice and other things that we train in geriatric medicine, is preventive medicine. So, once the patient hit the baby boomer age, then we go into prevention. And yes, we ask them about, if the person at risk of deep vein thrombosis, the lower extremity or the lungs. And we have a higher tendency of diagnosing patient, let's say with pulmonary embolism, than sometimes the pulmonologist. And the reason being is because by the time they go to a pulmonologist, the patient is in the hospital. But because we do a lot of screening, and the person come to us with different condition, calf swelling when they just came from a trip. We do the measurement and we get more than 2 centimeters, one calf from the other one. Then, all the alarms go off. And we are different also in the fact that we have the ultrasound equipment right at the office. So we don't have to tell the patient, go to the hospital, or I couldn't get an appointment, I got lost. The patient is right there. So we start doing the evaluation immediately.
I have to second that. I think you're seeing these patients, like you see, especially with blood clots, those are patients that I love to see because a lot of times those individuals have blood clots, the symptoms don't entirely resolve. They get what's called post-thrombotic syndrome, which is after a thrombosis, they still have symptoms. And a lot of it is because now they've damaged some of those veins. Those clots don't entirely resolve. The valves get damaged. And there's a lot we can do for these patients. And I treat patients with previous clots all the time. I actually had a really interesting gentleman that we treated. He came in and he had a clot about 20 years ago. His legs completely discolored on the outside. He had some 2 ulcers already. And he said, there's nothing that I've been able to do about this to get it to correct or feel better. We ended up doing some of our procedures, which obviously are all outpatient, 15 minutes. We do the procedures, no sedation. You walk out, literally can drive yourself home, do whatever you want that day. And we treated one of his legs. And then the couple of days after, he went to England. And he
wait, what is the procedure like?
The procedure, it depends what you need done. Okay, there's so let's talk about what you find on the legs. You can have spider veins, which are little tiny veins that come up. You can have larger varicosities. So that's two different stages of disease. If you go to more advanced disease, you start getting skin discoloration at the calf and below, between the ankle and the calf. Some people say this is called cellulitis. It's not a true infection. It's basically just inflammation from the venous hypertension. So your legs get really, really red or they have some brown discoloration to them. And after that, you end up going into the phase where you're starting to destroy the skin because those red blood cells can't get out of your leg. The red blood cells that die in your leg deposit iron, so you have iron staining, and that's why they get that brown pigmentation. Enough of that, and people end up getting venous ulcers. So this person was basically at the end stage of venous disease, and he went away for 3 months, and literally the day he flew in, which was I think like 9 a.m. in the morning, he came straight to my office. And I saw him and I said, oh man, there's got to be a problem here. And he goes, Dr. Mai, can you treat my other leg today? And I said, what are you talking about? He goes, my leg has never felt this good, and I couldn't wait to get back to get the other one treated.
Wow.
And it's like these responses, some of are just unbelievable.
And I hear the same thing, Dr. Mai, with a lot of the patients that you and I have been working with together.
And so that's the thing. It's about education, and we can do a lot for the patients. We can do a lot of patients. And, it's the problem is that a lot of patients don't know that something can be done. And so let's talk about the symptoms. One of the biggest symptoms is leg pain. At the end of the day, patients are like, my legs are in pain. I just don't feel comfortable. And I usually just ask them, okay, well, let's say you put your feet up on the ottoman. Did they feel better? And patients are like, oh, yeah, they feel much better. Okay. So they're probably having not only some pain, but also some heaviness. When you put your legs up, you feel better. The other question I ask is, at the end of the day, are your legs feeling worse than at the beginning of the day? And I said, oh, yeah, they're much worse. Well, it's because when you're laying down all night, your legs get to recharge, get the blood out of your legs, and then you wake up in the morning, you feel good. So pain. Another big one is swelling. I think swelling is multifactorial. It can be due to different reasons, but one of the big ones is venous disease. Cramping at night. It's unbelievable how many patients, and that's one of my first questions I ask. I'm like, do you have cramping at night? And a lot of patients are like, yeah, it wakes me up in the middle of the night. I go get some water. I open up the window. I feel better. And so I say, well, you're dehydrated? They're like, no, it's definitely dehydration. I said, okay, put these pair of socks on. Come back in a week. Let's see what happens. And the patients come back in amazement, like, the cramps stopped. What did you do? These are my magic socks. I need more of these socks, and then we start the conversation. But that's always an interesting one.
But, we've seen a few patients, Dr. Mai, that they had been told by other physicians that they have lymphedema. Mm-hmm. And then you and I will see the patient, and we treat the patient, and they get better, and it's not lymphedema. Can you distinguish between these two conditions?
Yeah. So, true lymphedema is a clinical diagnosis. We as physicians think it's a clinical diagnosis. There's ways, obviously, to diagnose it with some radionuclides and looking how the lymph tissue moves up the leg. But with lymphedema, it's basically swelling. And so we have to identify, is it swelling due to, lymphatics not working? Is it swelling due to some of the veins not working? But, what's interesting is advanced venous disease, you get lymphatic damage. So how does the lymphatic system work? The blood.
Before you do that, you know what? If I don't, people are saying, okay, I need to go there. I don't know where to go.
Oh,
so
yes.
Give the phone number.
We do this all the time.
Pencil Talk Radio. Here we are. Write this down. This is the Fort Lauderdale office where you'll be able to make an appointment. They're open on Saturday. So go. It's 954-489-1345. I'm going to repeat that. Pencil Talk Radio. Write it down. 954-489-1345. And if you're closer to the Palm Beach County, you can call them at 561-270-6494. But do something about it, please. And they're open on Saturdays.
At least get checked. Yes.
Get checked. Okay, go ahead. I'm sorry, lymphedema. I just wanted to make sure
lymphedema. We do have patients with true lymphedema, and we actually offer them a lot of things. I had a lady that came to see me yesterday, and she has lymphedema. We got her lymphedema pumps, and these are just incredible pumps. What the patient does is they can put them on in the morning or in the evening. They're watching TV. They plug the pump on their legs, and they basically turn the pump on. The pump does all the work.
Those are great.
And it feels, I got to tell you, I have one of these pumps. It was donated to me by the company. We lend them to some patients when we need to try them out. And it feels like you're just getting a great leg massage. And that's what the patients say. They said, look, they feel so great. I feel like somebody's working on my legs, giving me a massage. And when it's all done, the swelling's gone, the lymphedema's gone. They put compression socks on and they can enjoy the rest of their day.
Well, Dr. Mencia, you did it again, You keep finding the most wonderful people. And so between people going there to see you, and of course, I know Ina is there today. And, of course, you have this gorgeous new med spa.
The med spa that is doing so well with the salt bed treatment. And Ina had been very involved in getting the med portion on the spa that was in existence for 26 years, and that's located in East Oakland Park. And right, Ina, and Ina put all her decorations.
Good morning, Anita.
Good morning, Ina. That's right. You had to take down all your decorations. But let's see. You know what? Valentine's Day is coming. So you have another job soon.
Oh, yes. We're going to make a lot of baskets.
Right. But I was just thinking about what Dr. Mai was saying, that if people would go to a med spa, it'd be amazing how helpful that would be for their all their problems with veins, wouldn't it? Isn't that true?
Oh yes, they are therapists that are trained, but you have to question, the therapist working on you, that are trained on lymphedema massage, and that's also helpful, like the pump, Dr. Mai.
Exactly. We use dedicated people who know what they're doing, and that's what this field of lymphatics and veins is all about. There's a lot of people that are doing this kind of work, but I always say if you're going to go to somebody who's only doing this type of work and is dedicated to it. I receive a lot of patients from other physicians. They've done some kind of work and the patient's unhappy or there's slept problems. They come in and we do a complete evaluation. We say, look, this is your problem. It wasn't treated to completion. So if I have any recommendations for anybody, I say one is definitely get checked out. Come in. If you have leg symptoms, let us see what's going on. If you had previous clots before, you're still having symptoms, let us address that and correct it as much as we can.
And you're going to talk to a lot of physicians because we don't get trained in medical school about the importance of the vein, unfortunately. So there's a lot of physicians you're going to talk to that's going to tell you otherwise. This is one of those conditions that you need to go and find by yourself.
And that's really an interesting point. As a community, as a nation, we've spent so much money on research in arterial disease. But what's interesting now is that there is 5 to 10 times as many patients that have venous disease and arterial disease. And we're going to see a huge shift in the next couple of years. A lot of the companies are developing a lot of new equipment and spending a lot of money to help patients with venous disease.
And one of the patients, before we go off the air, one of the patients that you treated was taking 3 water pills to keep the swelling down, and he wasn't doing it. Mm-hmm. And after you treated the patient, we have her on 1 water pill, and I think it's more for the psyche than for the leg, because she wants to be on something. And
I just have to tell you all that I see the credentials of Dr. Mai. It's so heavy I can hardly pick up all these pages. You really have trained yourself well. So, yeah, I think we're very fortunate.
We are fortunate to have
I appreciate it. Yeah, my life's devoted to veins, and this is all I do. I don't do anything else. So I try to, stay on top of everything and help every patient that I see.
Okay, that's great. Well, thank you, Dr. Mencia. You've been wonderful. Are we finished? Are we out of time?
Thank you, Anita. Yes, we are out of time, and Dr. Firman is here. We should have brought him in because Dr. Mine had been to Hawaii. I grew up in Hawaii. Dr. Firman was in Hawaii. It could have been a Hawaiian show.
There you go. See? A little luau.
Just do a little hula before you leave.
Yes. Okay, Anita. Have a good one.
Yeah, thank you. Bye.
Bye-bye.
Bye-bye.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.